Good evening, everyone. Thanks so much. We've begun with a bit of a bumpy start, but I'm just going to begin already. Thanks so much for joining us this afternoon. My name is Rohan. I work with Quicksand, which is a design research and innovation consulting practice. We've been working since the past 2 years to facilitate this community of practice called CoreNet. We're really grateful that you could all join us here. We'll soon have Dr. Priya Nanda from the Bill and Melinda Gates Foundation, who at some point later will share a little bit more about the community of practice that has been, and we'll come back to that. But effectively, since May 2020, CoreNet has been initiated, and we've had researchers, over 60 organizations that have worked together to share and exchange their thoughts and learnings from the COVID-19 pandemic. To Dr. Patel and the Lancet Commission, Citizens Commission on Reimagining Health Systems in India, to be doing this opening plenary for us this afternoon. Maybe I could do a round of introductions for Dr. Patel and Rukmini, who are already here, and then wait while the other people join. Dr. Patel is the Pershing Square Professor of Global Health and the Wellcome Trust Principal Research Fellow at the Harvard Medical School. He co-leads the Global Mental Health at Harvard initiative. His work is focused on the burden of mental health problems, their association with social disadvantage, and the use of community resources for their prevention and treatment. He's also the co-founder of Sangat, an organization which won the WHO Public Health Champion of India Prize. We also have Dr. Jameel and Dr. Banerji, who I will wait for before I introduce them. We also have Rukmini S, who's joining us right now. Rukmini is an independent data journalist based in Chennai, India. Her work focuses on socio-economic issues, including gender, inequality, health, crime, and politics. She was the first national data editor of The Hindu and the editor of the Data and Innovation at HuffPost India. She's now a columnist for Mint and India Spend, and also an occasional writer for Indian and foreign publications. In March 2020, she also hosted a pandemic podcast called The Moving Curve, and her first book, Whole Numbers and Half Truths: What Data Can and Cannot Tell Us About Modern India, was published by Amazon Westland in December 2021. With that, I'd like to pass it on to Dr. Patel to kick things off while Babita and I managed to get the other panelists in. Over to Dr.
Rohan, the program suggested that Priya Nanda was going to say something about CoreNet.
Yes, we're trying to get Priya into the room.
She's also unable to join.
Okay. Yes. And
okay.
Yeah.
All right, so maybe let's get going, and let's hope that the others can join in. Thank you, Rohan and CoreNet, for organizing this this discussion that we're having today. We have only about 50 minutes left for it, so let's get going. So as Rohan mentioned, my name is Vikram Patel. I'm a psychiatrist, and maybe I could just start by making some scene-setting remarks. So the hope that we're going to cover in this particular 1 hour is really two questions for all the panelists. What have been the key learnings that each of us has observed in the past 2 years during the pandemic? Our panelists really cover some very distinct and different but very relevant areas of our society that are very relevant, both from the point of view of the impact of the pandemic, but also the second question: what would we do differently going forward in the interest of future preparedness of our society for crises, not just like the pandemic, but also other crises that India faces, such as, for example, what we see right now, the huge uncertainties in food security, but also, of course, climate change. So with that in mind, I wanted to maybe just kickstart from my own perspective as somebody who's worked in the mental health field for most of my life. I mean, it goes without saying that the last 2 years have been tremendously impactful on mental health in a variety of ways. We now know, for example, that there has been a dramatic increase in the burden of mental health problems, although we have no data from India, but data from many other countries published recently in the Lancet clearly shows that there's been a dramatic increase in the numbers of individuals who have depression or anxiety, and not just feeling miserable, but actually depression or anxiety as clinical conditions in the last 2 years. In fact, that analysis computed that about 50 million additional cases have occurred globally. And of course, a significant number of those will be in India. There's also been an uptick in suicide mortality in a number of different groups in the population. In particular, the youth population has been very severely hit. And I'm hoping when Rukmini Banerji joins us, that she speak a little bit about some of the factors that might have led to that. But I think it's important to emphasize that for much of the early phase of the pandemic, we were very concerned about the mental health of older people because of the risk that they had to experience severe COVID, but also because of our fears that isolation was particularly damaging to their well-being. It turns out that exactly the opposite end of the life course has been worst hit when it comes to mental health. And this is a consistent finding from every single country in the world, clearly indicating that there is something about the pandemic, the lockdowns, the school closures, the loss of employment, and a variety of other factors that has especially hit young people the hardest. And of course, I would add the lack of ability to interact with other young people, given the importance of peer relationships. So in a nutshell, this has been a pretty bad 2 years when it comes to mental health, especially for young people. But here is a couple of positive things that have happened as well. There has been a dramatic increase in the recognition of mental health as a key component of well-being. And it is important to acknowledge that this has been a transformation in the last 2 years. Mental health has always been the hidden subject. It's always been in the shadows. It's always been stigmatized. But in the last 2 years, the conversations of mental health have been very open and in the public. It's very commonplace now, for example, for people to ask about the mental health and well-being of workers who are in the Zoom economy. It's very common for people to recognize that there have been significant mental health impacts of the uncertainty and loss that people have experienced around the country and indeed around the world. And there is an acceptance, actually, that mental health is an issue that is relevant, important, and that both workplaces, individuals, and society as a whole should respond to these mental health needs. This is a huge transformation thanks to the pandemic. Another important transformation has been the rapid embracement of telemedicine platforms for healthcare more generally, but for mental health in particular. And I think this has also meant the shift from a focus on medication and diagnosis, which has dominated the mental health field for decades, to one that recognizes that psychosocial support, because that's what you can give on the telemedicine platform, is in fact central to supporting people who are in distress to recover from their mental health problems. So the importance of both telemedicine platforms, and of course the budget this year specifically supports telemedicine platforms for mental health. This is of course not direct to the user necessarily, but also supporting primary healthcare providers to deliver mental health care. But telemedicine has become rapidly incorporated in our understanding of extending healthcare and mental health in particular, and of course, psychological interventions. And finally, another very important thing that's happened in the last couple of years is a recognition of the importance of social connectedness. The connectedness that each of us have with one another, in the workplace, in our neighborhoods, in our families, in the variety of different social groups that we occupy. The connectedness that we have with each other is central to understanding how we can promote well-being and how we can protect our mental health going forward. And again, I think this fundamental idea, the demedicalization of mental health through psychological interventions and through social capital or community connectedness have been also very important advances in the last couple of years. Let me move on to the other very important area, and here I'm going to invite Rukmini. One of the key issues that I think we've all grappled with in the last couple of years has been the question of public trust. And public trust has been, of course, very contingent on the quality and the transparency of data and information that is shared by the government and by other agencies in our society regarding the pandemic. And so, Rukmini, I'd like for you to now enter the conversation and tell us, what have your observations been in this regard? Rukmini, over to you.
Hi. Just a quick intervention to check if we also have Dr. Banerji and Dr. Jameel joining us already. Just want to say a quick hello and see if you can hear us, Dr. Banerji, Dr. Jameel.
Yes, I can hear.
Right, so I'm going to invite Rukmini to talk about data. Thank you. And maybe you could remove the slide, this coordinate slide, it's distracting. Thank you.
Sorry, Rohan, should we revert to Dr. Jameel speaking before me as earlier planned? Because
Sure, I'm happy to do that if you prefer. Shahid, let me turn to you. Shahid is of course already been introduced, and I'm so glad you were able to join. You may have heard my remarks, the observations about what we have seen in the last couple of years. Shahid, you've been one of the not only one of the most important voices coming from the field of virology, but also more broadly as one of the leading scientists from India. I wondered whether you could speak to both the broader issue of what you've observed in terms of the role of science in the last 2 years, and perhaps more specifically on the role of vaccines as a particular example of science and the pandemic. Over to you, Shahid.
Thank you, Vikram. Thank you for having me on this panel. So a couple of observations very quickly. The first one is that science has truly been a savior in this pandemic, whether it comes to testing, and we've seen how quickly we moved with testing, as also with vaccines. Within a year, several vaccines were available and were licensed. And many people don't realize that COVID will be the very first pandemic ever in human history to be controlled with a vaccine. And that's a major, major achievement. The second point is to use science to drive policy, and that is very important. But for that, access to data is important. For example, granular data is needed for forecasting models that allow better preparation and deployment of health infrastructure and materials. India has a mixed score on that account, and I think Rukmini will highlight some of those data gaps, so I will not say anything more there. India has done very well with vaccinations. So as of today, India has deployed 1.85 billion doses of vaccines, primarily Covishield and Covaxin. As far as the adult population is concerned, roughly 96% of adults in India have received 1 dose. About 81% have received 2 doses, but only about 16% of the 60+ population has received any booster. So that's an important gap that we'll have to worry about. And that's a key gap. The booster choice has also been a key gap in India. Although India has licensed 9 vaccines, and India is producing 5 vaccines, is mainly Covaxin and Covishield that have been deployed, and boosting has also been homologous. So for example, people who got Covishield are getting Covishield boosters, and those who got Covaxin are getting Covaxin boosters. Although global science is a little different from this. So that's one gap that I would like to highlight. The fourth point and final point that I want to highlight is this question that people are asking: is the pandemic over? And for that, one has to realize that pandemics are not just biological, but also social, economic, and political events. Every country or region is deciding whether to end the pandemic, when to end the pandemic based on data. And so should India. One good indicator would be when mortality reaches that of seasonal flu. Europe is getting close to that. So seasonal flu, the mortality is roughly 0.1%. In Europe, several countries are in the range of about 0.12 to 0.2%. US is still at 1.5%. And surprisingly, India, although the numbers are very low now, only about 2,000 infections per day and roughly 50 deaths, the mortality rate is still about 2.5%. This could be due to various factors, poor healthcare infrastructure and all that. So I think we'll have to just make a policy and decide what is going to be acceptable to us when we will say that the pandemic is over for us. So I'll stop there and maybe come back later. Thank you.
Thanks a lot, Shahid, for those very, very insightful remarks. Let me then turn directly on to Rukmini S. It is about data that was really wonderfully follows on from Shahid's comments about transparency and public trust. Over to you.
Thanks very much, Dr. Patel, and thank you for having me on this panel. I couldn't agree more with Dr. Jameel in that the lack of access to data in some aspects, in particular, severely hamstrung India's COVID response. And I do want to say that going into the pandemic, and particularly as a journalist accustomed to working with Indian data, not just in health, but in other sectors as well, I am pragmatic about the limitations of the Indian state. And this pragmatism doesn't mean that then we become accepting, we keep pushing for reforms. So, when it comes to things like disease surveillance or death registration systems that we know going into the pandemic were not in great shape, and missed a lot of disease and death in non-pandemic times as well. These were sort of underbaked systems, and perhaps improving them at a national scale during a pandemic is an unrealistic expectation. Although this doesn't mean that we completely stop work on improvements in these systems during the pandemic. But in addition to these large structures that could not be changed overnight, there were capabilities in data that could have been built over time, considering we're well into year 3 now, which were not. And there was some amount of obfuscation around available data. There was some amount of privileged access to data that should have been more widely available. And additionally, there was some amount of outright denial of data that I believe should have been more widely available. So one of the things that happened is that there wasn't enough taking stock about the gaps between what the data infrastructure was saying and what was actually happening on the ground. And one sort of stark example of this is the fact that India's official definitions of what should have been counted as a COVID death on paper are progressive. They're in line with what the WHO recommendations were, which is to not rely on tests alone, which is that, even if there's a suggested COVID death or a suspected and unconfirmed COVID death, you should have sort of, erred towards leniency and counted these as well. We know that from day one, this did not happen. We know this from conversations with state governments across the country. And there hasn't been that sort of taking stock that here are our definitions, here's what's happening on the ground, what are we going to do about all this data that we're missing? So that often did not happen. Similarly, states that were not building systematic processes to create health bulletins that would give regular information were not sort of taken to task at any time for not providing that information. So India's largest state, Uttar Pradesh, still provides its daily data, which is often not daily, on a closed WhatsApp group of journalists. It is still not publicly available more than 2 years into the pandemic. And you don't hear much noise about this either. Then there was the issue of privileged access of data to data which should have been more widely available to researchers. In April 2021, over 200 scientists wrote to the Prime Minister asking for access to data, including that from the ICMR's database, which could have given valuable information about the progression of the disease and our response to it. And seeing those dates, seeing April 2021, which as we now know was the sort of cusp of the brutal second wave that India went through, it's particular, it bears repeating that we've still not had, and none of these scientists have seen that data yet. And then finally, there was some amount of pushback and intimidation of journalists and other people reporting on inconvenient data. There have been a lot of there is a lot of hope from this to take from this as well, and particularly I feel this in the case of local level innovation. While there are examples of very closed data systems, there are states like from as small as Nagaland to as big as Tamil Nadu and Kerala that have that produce enviable amounts of data that are made public. So there is that end of it as well, and we have Indian states that we can learn from. But there's also institutional issues to think about. Institutional stroke democratic issues, which is to consider the question of what are the legal and institutional structures that need to be put in place to make sure that not just pandemic or COVID or health data is available without question and without battles and without RTIs and without court cases for the future. Is there a right to data that needs to be put in place to make sure that data that is exists within various acts is actually provided by the government? Is there political pressure that needs to build? Has this constituency not developed? So there is a gap in the democratic structure itself that has allowed so much of data to not be available to us this long in. And we need to think both about legal and institutional structures as well as democratic processes to fill these gaps for future crises that may include pandemics, but as you mentioned, could extend even to issues like climate change and food security.
Thanks, Rukmini. I mean, I think you really hit the nail on the head about the question of transparency. And, a lot of this, of course, is what undermines trust. To me, that's the fundamental consequence of that, trust that people have in the government and one another ultimately also, when different data, when you don't have the honest and sharing of transparent data, it means that different perspectives and misinformation, it's fertile territory for misinformation to actually take hold, and then you have very different narratives that start competing with one another, and the whole thing becomes politicized, when in fact this should have been a national calamity in which everyone was bringing, was brought together actually, and the data was central to be able to monitor what was happening and how our actions were failing or succeeding. One of the things that I've noticed is, of course, the huge gap between the government's reports on mortality and virtually every single effort that has come from the grassroots, ground up modeling, no matter what methodology has been used. The gap is 5 to 10-fold. And I think this is a gap that still no one has actually fully addressed, and I wondered whether you could just comment on this. How do you explain a government simply not discussing even a 5 to 10-fold gap between its reported deaths and what every single other sector is actually reporting?
I'm very glad you brought this up, and I would love to talk about this. I did one of the early reports on this from the state of Madhya Pradesh because I got access to civil registration system data as of May 2021, which was the real brutal end of the wave for the second wave for Madhya Pradesh, and I was able to report on it in June 2021. Subsequently, I was able to access similar data for the states of Andhra Pradesh and Tamil Nadu, the city of Chennai, and other regions. And what I'm particularly proud of the Indian data journalism or the Indian journalism community for is that this became a sort of domino effect, and journalists across the country started doing similar work, getting access to civil registration system data and comparing it with tolls, with officially reported tolls. The pushback from the government has been quite severe and quite consistent. It started with a sort of ignoring of these numbers. We were reporting about these every day and it was being systematically ignored. But when these numbers were then used by respected academics to produce academic papers published, peer-reviewed in scientific journals, that's when there was some amount of denial and pushback. And the question here then became about whether civil registration system data in India is good enough to make these claims. I don't think anyone is arguing that civil registration system data is perfect. It's the next best thing. It is one of the innovations that journalists have been forced to make across the world, from the UK to Peru to India, to reach closer to what would be a more honest number. And just one final point I want to make, which is what the point of these numbers is. It is in a way to give dignity in death and in statistics to people whose deaths, if we otherwise ignore, is insulting to their memory and is hurtful to their families. The wave of the reason that there was such little pushback from readers and so much acceptance from readers, in fact, is because this is what they were observing in their communities and in their villages. So this work, in a sense, validated the immense trauma that most of this country went through in the summer of last year. And we can debate how good the data is, and we would like better data, but to entirely ignore it, to use a word that young people use now, is gaslighting an entire country in a way.
Thanks, Rukmini. Let me move on to Rukmini Banerji now. Dr. Banerji, you have been one of the champions of education, children's education in this country, particularly with your leadership of Pratham. I wonder, this has been another big area that has been profoundly affected in the last 2 years. I don't think we've ever witnessed the closure of our schools for a period of 2 years in our history. Probably ever, ever since education began. This is what a dramatic policy intervention that was. Maybe what I want to hear from you is, first of all, your observations about the impact of the pandemic on schooling and children's well-being in the last 2 years. Let's start with that.
So maybe Dr. Patel, before I get to your question, I want to just take a few threads from what the other Rukmini was saying. In fact, I've been meaning to ask her that in her very interesting book, she doesn't touch on education. So I'm hoping there's another whole book that will come out on just education. But just to take the thread further, you do need, obviously there's lots and lots of different experiences of the pandemic that are going on, but you do need some rigorous data to understand both what is happening right now, as in the last 2 years, and how we look at what is happening today, compare it to what was happening before, so that we can make some kinds of plans or projections moving ahead. Now, the annual status of education report, the ASR report that Pratham helps to bring out, has been in existence since 2005, every year till 2014, and then every alternate year. And 2020 would have been the appropriate year to do this. Obviously, we couldn't do that, but a couple of interesting things have happened. One is you needed, at least for education, and I'm sure for everything else, you need to be able to compare to what was it like in normal times, so that you can understand what is different right now. And the existence of this, although what we collect is very basic. Can children read? Can they do math? Do they go to school? But I think it helped to compare the past with the present. 2018 was the last big ASR survey that we did, that went to every rural district in India. And it so happens that we collect phone numbers for doing cross-checks and verification purposes. We never thought that those phone numbers will come so handy, because we were able to do both in 2020 and in 2021 phone surveys using a nationally representative set of phone numbers. And there, because we couldn't actually look at children's reading or math, we asked a whole bunch of questions of what was happening in the household, which was actually very interesting to us. And it came out of a representative sample and not just, where you could actually access people. And couple of things which were counterintuitive came out, which I think are very useful and as we think ahead. One was that both in, particularly the 2021 phone survey, we saw that government school enrollments had gone up. Now remember, everybody was expecting massive dropouts, but we saw that there was perhaps some benefit in remaining attached to a school. It's only now when schools have opened and they're settling down that we'll be able to track attendance to see if the enrollment is matched by the attendance. The second thing that we saw, because there was so much faith
I think we might have lost Rukmini, right? Is that me or is it her?
Yeah.
It's Rukmini. Okay. Let's hope that she can connect back. So let me just maybe move on, and hopefully when Rukmini rejoins, we can invite her to speak about both her ongoing remarks as well as the future. Let me then turn to the second big question that we had. And this is let me again start with the same order. Shahid, you first. Based on your observations over the last couple of years, what do you think India needs to do at any sector of our society to strengthen the role of science going forward in preparing the country, to make the country more resilient? Rukmini, I'll come back to you. I'm now going to move to the second question. I'll come back to you so that hopefully you can combine your remarks on what you were saying as well as the future observations. But I'm going to ask Shahid now, what do you think might be the role of science going forward? How can we strengthen science as a foundational component of decision-making and policy-making in India?
Am I audible to you? Yeah, okay, wonderful. So there's clearly need for more funding in both research as well as in health systems. But let me address two very broad issues here. The first is, what might be the path to future pandemic mitigation? And so knowing what might emerge in human populations will be important going forward. And for that, routine genomic surveillance, serological surveillance will be needed. We've seen a lot of that happen during COVID, but somehow it has not been applied to other systems. And one example of that is a fairly bad dengue outbreak towards the later part of 2021 in certain parts of the country. The INSACOG, which is the sequencing group, was in place, but INSACOG was not given even one sample of dengue to sequence. We didn't know whether this bad outbreak was because of a new serotype of the virus, or whether it had something to do with vector populations or what. We didn't know anything. So the point is that when you have set up an infrastructure for COVID, if you're not using the same technology for other things, then you're not really using systems optimally. So going forward, I feel that a One Health approach to stop infections would be required. And this would be required for animal populations before the infections reach humans, because that is really going to be the most efficient way of doing it. And for that, India will need coordination at the highest levels. What I mean by that is that for a One Health approach, the things that you look at are human infection, human disease, animal disease, and ecology and environment. And currently these are looked at by 3 different ministries. So human health by the Ministry of Health, animal health by the Ministry of Agriculture, Department of Animal Husbandry, and ecology and environment by the Ministry of Environment and Forests. And so unless there is coordination at a higher level, the One Health approach, which is very much needed, will not happen. Funding for pathogen discovery research needs to be a priority as we go forward, as should funding for other health research and strengthening of health systems. The second point I want to raise is looking at what happened during the pandemic. We saw that the Integrated Disease Surveillance Program and the National Center for Disease Control remained highly underpowered. And that resulted in an organization like ICMR, which is essentially a research organization driving pandemic response. That is clearly not optimal. What India requires is a CDC-like structure. We need a clear command structure with defined roles and trained manpower. health systems need strengthening. And if you allow me, the health minister said in the parliament 3 days ago that the doctor to population ratio is 1 doctor for every 834 persons, and the nurse to population ratio is 1 to 500. This is reaching the levels that WHO recommends. The problem is that most doctors practice in urban areas and many don't practice in rural areas. So that gap still remains. So overall, health system capacity strengthening and more funding for discovery research, more funding for health system strengthening.
Thanks, Shahid. I've heard this call for a CDC, such a structure institution in the Ministry of Health. I think that it's called an NCDC or something like that. But somehow, there are, I think you're right to point out the real fundamental problem is that there is very little intersectoral collaboration when we face something like the pandemic, which is far more, as you rightly point out, than a biological event, but in fact is a major social event. And I think the fact that all these different institutions didn't really have a clear coordination amongst one another is one of the great lessons that has arisen from the pandemic, and I hope it will be addressed in the very near future. Let me now turn back to Rukmini Banerji. Rukmini, before we lost you, you were just talking a little bit about the ASAR findings from 2021. You were talking about how, in fact, enrollment numbers had gone up, and then we lost you. And so maybe in your remarks, you can cover both your observations about children's education, the role of technology in the last couple of years, and perhaps then move on and also speak about what you'd like to see are the lessons that have arisen from these last 2 years for what your aspirations are for the way our society responds to children's needs going forward.
So very quickly, we also actually managed to do 3 field surveys in 2021. And interestingly, 3 states, 2 were actually demanded by the state government who wanted current data to be able to act on it. One was Karnataka before the second wave, one was Chhattisgarh after the second wave, and West Bengal in December. All 3 showed significant and deep learning losses, even in the very basic competencies of sort of reading and math. And I think that a lot of other unmeasured declines, which we are not able to catch in surveys, have also happened. Now, given all of this, what do we do as we go ahead? Because the current learning levels, especially in the primary grades, are at the lowest they've been in the last 10 years, or at least since we've had ASAR data. Again, looking back, I think is very helpful, because let's say if I take a case of UP, which is the largest, biggest, and one of the most backward states in education. If I look in the past, in a normal typical year, you make something like 10 to 15 percentage point improvement in learning on very basic things, which varies a little bit based on cohort or grade. But when we look at past experiences of having done very focused learning programs, which have prioritized the fundamentals of learning, we see that it's even possible in 30 days, 40 days to achieve considerably higher gains than what is normally possible. Now, all of this to say that even the evidence that exists and the experiences that exist suggest putting aside the curriculum, at least for the grades 3 and above, and focusing on fundamentals, because our past data shows that if you do that, you may be able to come back much stronger than where you were before. So that's, I think, this is a very right moment to perhaps bring in some of these changes that were long overdue, but we didn't get around to doing them because, business as usual dominates. And the second thing I'd like to say before I stop is that think about the kids who are in first and second today. They've never been to school. They've never been to preschool. They've literally come out of their laps of their families into school. So absolutely inappropriate to use our regular curriculum or expectations or textbooks. And I think this is the time we have to give them to sort of get ready for school, get ready for class, get ready for playground, get ready for each other, and get ready for learning, which to me is again a very positive, promising opportunity to bring in this broader breadth of the kinds of things children need for comprehensive development, because, we didn't do it before, but maybe we can stop and do it now. We see quite promising moves being made sometimes by the Anganwadi system now, who I think are realizing that given the new education policy, which is going to focus a lot on foundational learning and is indicating that you begin in early childhood, that perhaps in addition to the catch up that I'm talking about for older grades, there could be a leap forward for the younger ones by really slowing things down and letting kids have a much broader based beginning to their educational life.
Well, I have to say, Rukmini, I hope I wish I could share your optimism. Somehow, I think the national education policy is a visionary document in many ways. The real devil lies in how it's implemented on the ground, and the structural challenges that children and families face, particularly in terms of the quality of teaching in many parts of the country. The costs of private education and the enormous bottleneck that happens later on during the school years when it comes to, in fact, moving beyond into higher education, and how we fix all of those will be just as important. But I wanted to ask you, and I know you want to respond to that, but I also wanted to ask you, when you respond, could you say something about this idea that took hold in the last 2 years, that suddenly all our children could learn online? Honestly, I personally found it baffling, because not even where I live in Goa, which has reasonably good internet connectivity, my niece could barely actually, she not only could she not get very good online education in a private school, but she just couldn't engage with online. It wasn't just whether you had the internet, but it's just that she was sitting at the age of 12, looking at a screen and wondering, her mind was everywhere except on her class. And so, where did this idea come from, and what is your prediction about the role of this online schooling going forward?
No, you're absolutely right, and I think that even in elite schools sitting in Delhi with very good connectivity, after schools have opened, some conversations I have had with teachers indicate that they are really depressed because they thought they were doing a really good job, but once the kids have come back, they find that a lot of that has not stuck at all. Put aside the fact that most children in India had no access to anything online, maybe just little drips and drops of things that could come through WhatsApp. Having said that, and I think this has all come from a kind of seductive allure of edtech and maybe a lot of money that is going into producing for the absolute elite. I feel like the excellent are always in wanting to become even more excellent, and then the entire focus of this industry that feeds this just ignores all those who don't have access at all. But having said that, I think that there definitely has been increased digital capability of teachers across the board. I see a lot of creativity, and again, Vikram, you're going to say, oh, I'm too optimistic. But I think that for once, because that age grade stranglehold of the curriculum was loosened up during the pandemic, good teachers were actually able to reach out in all kinds of different ways that suited their children. As soon as schools have opened, all of that creativity will dry up, because you will be back to the grind with your exams and textbooks and so on. But I do feel that this increase of digital capability at home and in school can lead to a supplemental angle, which could be quite useful. Now, just the other day, we were talking about, we are not measuring what kids have actually learned. They may have learned some little words of Korean. I was in Assam visiting villages, and we, in our own programs, we have children's groups. So many groups which are called Pushpa, which means that you have picked it up from somewhere. So there's a lot of non-linear stuff that has happened everywhere. There's a lot of stuff that, in a slum area, kids were I was asking kids, where did you find out answers to your problems? They said, हमने अपने बड़े दीदी से पूछा. So I asked the बड़ी दीदी, तुमको कैसे मालूम हुआ? And she said, very obviously, YouTube से मालूम हुआ. So I think that these are all, snippets. I don't think there's a massive explanation, a massive silver bullet coming from everything online. But I think judicious understanding of what worked, what didn't work, trying out experiments should continue, because, individual creativity, being able to choose, all of those were important things. And of course, a wider spread connectivity and availability of devices will happen. But human beings, one thing that I've come out from the pandemic is human beings are even more important than before for young children.
Absolutely right. And as you know, I've been very passionate about this subject myself, and I often say that what we did in this pandemic is throw young people under the bus. And by young people, I include children. We basically shut down the single most important sector of their lives without even asking them. And of course, the greatest irony is that we now know that in fact, almost no transmission really occurred in these populations. Where it did occur, it could have been easily mitigated by, particularly in our climate, having schools run outdoors, having, the great news is that, India has great climate for ventilation. And it's always been one of the great, sadnesses for me that rather than the axiom that is now prevalent in the US, schools should be the last to close and first to open, have not in fact been implemented in the country, which could have done it right at the beginning. In fact, in my home state of Goa, casinos opened before schools did. And it tells you a little bit about really what we prioritize in our society. It goes without saying. Rukmini S, let me go back to you now. And given all that you shared with us about, the challenges that you have faced, you and journalists have faced in getting data for public communication, what do you think are the key lessons that we need to incorporate in our society to make sure that data are available, they're open access, they're trustworthy, etc.? Rukmini.
So, and in the spirit of Dr. Banerji's comments, I'm also going to look at some of the silver linings from all of this, particularly for data. One is that there was, in a way, a sort of democratization to some extent of access to experts and scientists. Many of us early in the pandemic were able to listen to people like Dr. Jameel, as they gave webinars on things, because it was such a steep learning curve for most people, particularly those who hadn't been covering science and health before. So much closer access to expertise has been one of the big silver linings. There's also been a strong sort of collaborative spirit, particularly between scientists and journalists, that has gone on in many cases. And in India in particular, there is a particularly public-spirited open data community that has existed for some time now, but that has really come into its own in crises in the last few years. This has happened in the case of floods in southern Indian states, and also very much in the case of the pandemic. So for, early in the pandemic, a bunch of young developers who chose to remain anonymous, many of them living in Bangalore, who had other day jobs, found that local and state governments across the country were putting out information, daily data in their own bulletins, but it wasn't being sort of pulled together. So there was no national source of disaggregated granular data, which was vital to understand changes going on in the country. And they pulled all of these official sources together to build what was then called COVID-19India.org, and which we have now taken on in a new form called COVID-19Bharat.org. So I think that sort of collaboration and public spiritedness has been one of the big silver linings. But I will say that there is, it isn't an alternative to building solid state-driven systems as well. And one of the challenges to consider is the more you build innovative systems like these, which sort of bootstrap their way to producing data that you're not getting from the state, the more I worry that democratic pressure on governments to produce data that they rightfully should be producing and releasing lowers. If we continue with these sort of open data solutions to what the government should be providing, perhaps that data will be available and in a much nicer user interface than the government would produce. But what does it mean for democracy is actually something I worry about. I know these are not either or, but I do want to keep the pedal to the metal and keep sort of that pressure on the government to continue to begin to provide data that should be rightfully ours.
Yeah, thanks, Rukmini. So I think as we are coming close to the end of the hour, I also wanted to actually emphasize there are a lot of lessons. The question really is, what is the appetite for our government to actually embrace those lessons? We've heard from all of you about what those lessons might be. Strengthening, I think key to this, of course, is transparency all the way through, accountability all the way through, whether it's in the role of science, and institutional independence in actually managing the health needs of our country, both in times of pandemics, but also more generally as we have at all times. Similarly, with the needs of children, their welfare, in particular education, and of course, very importantly, the role of transparency of information, so that we don't have to constantly be applying for RTIs to get information that should rightfully be ours and communicated freely. I think there also needs to be a more balanced perspective when we think about policy actions on thinking of the counterfactuals. That is to say, what is the impact of these policy actions on other areas of our society? And I always think that the closure of schools reminds me of the fact that when we model, for example, the impact of school closures on reducing the transmission of COVID, it struck me that the absence of any modeling of what impact this would have on children struck me as an example of, very one-sided or almost blinkered policy making in India. And this is unfortunately what happens around the world as well. This is not only true of India. Certainly, to be optimistic in my own area of mental health and universal health coverage more generally, I do believe that in fact there are many new opportunities that this pandemic has thrown up. I've already spoken about telemedicine and the importance of psychological therapies, but more broadly, the role of frontline workers was thrown into sharp relief. Let's be quite honest, when we started the pandemic 2 years ago, all the emphasis was on, the big private corporate hospitals and ventilators and, doctors in white coats. It turned out actually that the most lives were saved by the humble Asha going door to door and giving the vaccine and helping people home quarantine, etc., etc. And I think it reaffirms the profoundly important role of a robust primary healthcare system and of our amazing frontline workforce as the foundation for our healthcare system in good times and in crises. Unfortunately, we don't quite see whether any new investment in universal health coverage coming from the government, nor do we actually see the single most important need of our frontline workers, which is giving them regular jobs rather than treating them as volunteers. And so it may be that the good news is still to come, but I think what we do need to recognize and appreciate is that the country was incredibly resilient in what some have described was probably the worst humanitarian crisis India has faced since partition. And that actually today, it's incredible that much of the mayhem that we experienced last year at roughly this time, in fact, has just become a memory. Whether that's a good thing or bad or not, I don't know, because sometimes traumatic memories are best left suppressed. But sometimes, if we suppress them for too long, then actually they do not give us an opportunity to learn from them and to actually change the way our system functions. I don't know if there's been any questions, Rohan, from anyone. Oh, there is a question. Perhaps let me just see there. So from Sanjeev Chabria, there was much misinformation. And the question really here can be answered by any of you here. Given the silver lining of collaboration between scientists and journalists, what can we do to ensure there is a knowledge base for citizens that is accurate and not propelling myths? And that's a wonderful question to end this with, and then I'll hand over to Priyananda for closing remarks. Any one of you, please just unmute. How do we go forward to build public trust? Shahid, let me ask you, yes.
Well, Vikram, trust comes from transparency. So if there, we've been talking about data. So if there is data transparency, that's one way of building trust. And also to, emphasize that the scientific method, doesn't mean that scientists are always right. Scientists are often wrong, usually wrong. Because it depends on the methods that they are using, the data that is available to them. So when a scientist says today something and tomorrow something else, it doesn't mean that she was lying either today or tomorrow. It just means that the analysis has moved forward. And we've seen this happen during the pandemic. We've seen it with face masks. We've seen it with ventilation. We've seen it all the way through. So I really feel that it's important to use evidence to drive policy and not make policy first and generate evidence to match that policy. That will bring in trust.
Evidence to drive policy rather than the other way around. Wonderful. Rukmini, did you want to say something, given this question is very central to your particular area? You're muted.
I agree very much with the points that Dr. Jameel made, and I just wanted to add that there is sometimes a sense in government that inconvenient or difficult information, if hidden or sort of understated, then it's easier to make points. Even if the larger information, the larger goal or intention is to put out accurate information. But I think we've seen that distinctly in the pandemic, that that's actually a truly dangerous path. So we've seen this, for example, with vaccine effectiveness. We know that the vaccines that we have are safe and effective, and there's excellent data from the UK, for example, that shows how much protection the vaccines did offer, particularly in the latest wave. But by not making data on AEFIs, for example, available, and by misrepresenting data on vaccine effectiveness in the past, as happened in India, I think we actually create an environment in which there are more doubts and there is greater suspicion. So that, to me, that is particularly one of the sort of areas of maturity that a government needs to demonstrate, which is to take on board difficult information that does not necessarily go align with your point. And this really comes back to the scientific method, which is, science isn't about reporting only positive findings as well. So I think that is an area in which we lacked, and that is an area in which governments need to think about how to be more effective in communicating in the future.
Banerji.
So I just, I love all this talk about data. I think having inconvenient data for a long time, like the USR data, almost paved the way, because a lot of fights had already happened. And whether it was the media, whether it was government, whether it was other people, I think 10, 15-year-old back and forth on, is this data correct? How does it compare to blah, 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 has actually been a healthy trend. So much so that actual state governments reached out to say, we need this data now to help us. So how do you create a culture of this back and forth, top down, sideways data happening that can actually be discussed constantly? And again, I don't want to overplay this point, but there isn't anything like USR in any other sector. Partly because you have to be absolutely hard-nosed and persistent, that regardless of what is happening, some citizen-led data has got to be out there. Maybe easy to do in things like primary education, much harder to do in health. But I think that going forward, what do we as people want to do in a persistent way and in a very timely way, year on year, should be thought about.
Thank you, Rukmini. That's a wonderful way to close this seminar. And I'm going to hand over to Priya to give us the final closing remarks.
Okay, thanks a lot, Vikram, and all the panelists. This was a fabulous kickoff for the conference. I just want to actually thank all of you. And the kind of discourse that we were having right now is really the motivation and the intention why CoreNet was formed. It grew organically out of like 10, 15 researchers who started to do COVID-related research, and we started to convene in coffee hours. And that really led to the growth of CoreNet, to have something much more systematic, rigorous, to create a community of practice, to foster dialogues, healthy dialogues that really are pushing the envelope of the research that we were doing, but also the research uptake. So the idea was to have much more ethic embedded research, much more conscious of equity and measurement, more scientific measurement, and then utilize it for uptake. So I think the conference and the dialogues that we are having is the community's mechanism to reach out, some difficult conversations into a public discourse. So I think this was a great start. And I also just wanted to say that, our CRVS is weak, our mortality data is weak. It isn't only that the COVID data has, poor performance. I mean, we have poor performance of data, our public health data writ large. So to me, what's important is the pandemic has brought up, and like you mentioned, Vikram, the issue of frontline workers actually brought up a lot of very important core public health issues which were not in the public discourse. And if they were in the policy discourse, clearly, we were not having these kind of large dialogues about it. So in a way, it's democratized discourse. And that's good. It gives us hope that more and more people are talking about things that really matter to all of us. And that discussion and discourse, moving science to people, to citizens, and to create engagement of citizens in the discourse around science, I think is really important. And that's what the pandemic did. And all of you are enabling that almost on an ongoing basis with either the research or the thinking that you're putting out there in all your platforms and venues and the positions you occupy. So I think to me, I'm really grateful that you all were there actually as the opening panel. And with that, I'd like to thank you all. And Vikram, any last words from you? Okay.
No, I think that is the last word.
Okay, so thank you actually, and thank you Lancet Citizens Commission, and thanks everybody who attended this and to the CoreNet community. Bye-bye.